So the aim of our study was actually to discover the underlying brain mechanisms of the effect of a bitter taste in administration on a few things, including appetite-related sensations, gut peptide levels, and hedonic food intake. And we were actually aiming for this because one of our colleagues found out by previous studies in our group that an intragastric bitter taste in administration is able to reduce hunger scores and to reduce those circulating levels of gut hormones who are involved in the regulation of appetite and food intake. So we designed a single-blinded randomized placebo-controlled trial in which 15 female healthy volunteers participated, healthy with a normal BMI, and they had to come to our test unit twice after an overnight fast, and we actually started every time after preparation. So after that they got their nasogastric feeding tube and intravenous cannula, that we gave them proper instructions. Then we positioned them comfortably in the scanner, so an MRI scanner, and we performed functional brain imaging for a total of 59 minutes. This included a baseline scan of 10 minutes, after which either our placebo condition, which was just distilled water, or quinine hydrochloride, which is a bitter tastant present in tonic water as a flavor component, dissolved in then distilled water again, were intragastrically subliminally infused at body temperature. And then we scanned for another 49 minutes. During scanning, participants have to rate their appetite-related sensations, so including hunger and prospective food consumption scores, every 10 minutes. And at the end of the scan, they had to perform an ad libitum drink test. So we asked them to drink a rewarding chocolate milkshake until they felt fully but comfortably satiated, and then the study was over. Then we had a washout period of at least 1 week, and then they just came back for exactly the same test day, but except for the infusion, it was different. So we placed the nasogastric feeding tube, so via the nostril, just into the proximal stomach. We controlled this position by aspiring some gastric fluids and checking for the pH, so that we would really be sure that the administration would be done in the proximal stomach. And then, whilst the participants were lying in the scanner, we just scanned for 10 minutes baseline scan, and then actually we just infused it via a syringe attached to the nasogastric probe, and that's actually how we did it. So it could be done in oral, but then we would definitely go for capsules, because in that case you could at least avoid repelling bitter tastant, because it's extremely aversive for most people, I can tell you. But yeah, for this design it was better to go for an intragastric administration, because we were actually interested in purely interoceptive gut-brain signals, so that we actually avoid any confounding effect of the bitter tastant on these gut-brain signals by bypassing then the bitter taste receptors on our tongue, and by excluding all exteroceptive properties, so that participants would not sense or taste our administrations, or at least the difference between our administrations on their tongue. And also because for our fMRI design, it was very, very crucial that we knew the exact timing of the administration. So by giving it manually directly into the stomach, we had proper control of this delivery, and with capsules they need to be broken down by the stomach. So you have an idea, but you don't know like really exact the timing. But of course, it's too early days to jump to conclusions about treatment options. But if we would go that way, we would definitely go for capsules, so that also participants would never have that aversive taste in their mouth. But for our design, it was not the most ideal way to go. Yeah, of course. But I think, as I already mentioned before, we really need to be careful about this potential effect, and I think that further steps are definitely warranted before we go to patient populations with obesity or even just overweight patients. And the next step that we are actually going to take is look at the brain responses to anticipatory food reward. So food reward elicited by food cues like the food pictures or the smell of food, etc. So we are going to present them with visual cues of high and low caloric food cues, food items, and they're going to perform a food reward task. So in that way, we can see actually the effect of the bitter or the quinine hydrochloride administration on the brain responses to anticipatory food reward. And we're first going to do this in healthy volunteers. So it's actually really just a prolongation of the protocol we performed now. And it would be really nice to translate this to obese patients or overweight patients. And then if those results are still promising, we can go and test like chronic administration, because now, of course, one acute administration, it's not enough to tell something about a weight loss management, so you need to test it chronically. But it of course, the results up to now are promising, so it really would be nice to go that way in the future, but it will not be for the next months. Yeah, so we used visual analog scales that were projected to a screen. So participants were lying in the scanner and they had a screen above them. And it's just a line of 10 centimeters, and they could move a cursor along the line using a button box that we provided to them in their hand. So they just had to indicate their score to several questions, and we used 4 validated and widely used questions, asking them about their hunger score. So how hungry do you feel at this moment? Prospective food consumption was assessed, asking them how much do you think you could eat right now? And we also assessed fullness and satiety, then asking them respectively, how full do you feel right now and how satiated do you feel right now? And we also assessed their nausea scores to make sure, more as a checkup for adverse reaction to the intragastric administration or for adverse events towards the quinine hydrochloride, but none of our participants reported any nausea scores throughout our study. So of course our brain activity was top priority during this study because it's the first time that anyone would look at brain activity after an intragastric subliminal bitter taste administration. So that was really our top priority. And then we assessed the hunger scores every 10 minutes. And we took blood samples 2 minutes before the ratings were collected, so that the blood sampling, because of course they can feel it a little bit that you're taking blood and they're manipulating their arm a little bit, so that it would not have an influence on the ratings that they would give afterwards. But for the rest, there was actually no priority. It's brain levels and then there's like behavioral levels, and we correlated those two then because we know the exact timings, etc. Yeah, it's true. Because maybe it's also important to note that we actually tested if it would be hedonic for our participants. So we had a really thorough screening beforehand, including a food preference questionnaire in which they had to like several sweet and savory items on how much they like it, using, again, a visual analog scale. Based on that, we selected potential candidates and invited them for a little taste session. So they came to our test unit and they could have a few sips of the chocolate milkshake that is used throughout the study. And they had to rate it, again, visual analog scales, asking them how much do you like the milkshake. And we only selected participants or potential candidates who scored higher than 6 on a visual analog scale from 0 to 10. Then 0 is I really dislike it, from 10 I really like it. And I think the average score was around 7.5. So we actually can say that it's hedonic for the participants that actually were enrolled in this study. And then during the actual ad libitum drink test, the milkshake was presented in big glasses, actually like a milkshake glass. And we instructed them to drink as much as possible to feel satiated, fully satiated, but still comfortable. So not that they're like overeating themselves. As well, they came at an overnight fast. So they were fasted. And if they really had like problems trying to grasp the idea of satiation, I told them, like, just drink as much as you would eat it during a normal dinner and that you feel satiated. So we just presented them with the milkshake and we filled the glasses again at the constant rate that they empty it. And then they just indicate, look, I feel fully but comfortably satiated, and we stopped the test. And that was also the end of the study. So yeah, maybe it's easier to start with the hypothesis first. So we actually observed them based on previous study on literature that we would observe an altered brain activity in homeostatic and hedonic brain regions, so regions involved in the regulation of energy homeostasis and then also more in the reward system, which are connected. We also expected to observe decreased appetite-related sensation scores, so especially decreased hunger and prospective food consumption scores, and a decreased hedonic food intake after bitter compared to placebo administration. And furthermore, we expected a mediating effect of the circulating gut peptides involved in regulations of hunger in the effect of the bitter tastants on the previously mentioned parameters. And actually our findings really confirm nicely our hypothesis. We did observe different activities in homeostatic and hedonic brain regions, so increased activity in the reward system after bitter compared to placebo administration. And we observed decreased appetite-related sensation scores accompanied, as we expected, with a lower amount of milkshake drank after bitter compared to placebo, and so a lower hedonic food intake. And we also observed decreased circulating levels of orexigenic gut hormones, so gut hormones involved in the regulation of hunger. And this is also correlated with the differences in brain response after our 2 test conditions. So we actually can confirm that there is a mediating effect of the gut peptides in the effect of the bitter tastings on then brain levels, and appetite-related sensations. So we were actually really happy with the results. So yeah, as I already mentioned, we asked them the 4 validated questions, and those questions normally behave in a pattern that fits each other. So hunger and prospective food consumption behave in one way, in the same pattern, and fullness and satiety in an opposite pattern, but also in the same way, those 2. And actually that was the case in our study as well. So fullness and satiety increased after bitter, and we did observe visually a decrease in hunger scores, although only a trend, so it just did not reach the significance level, although prospective food consumption scores did. And we actually think that this also might be by the interpretation, because hunger is more interoceptive, and whereas prospective food consumption score, you can actually see it as a little bit more of an exteroceptive sensation. We might think that the difference might be explained by the fact that it might be easier for the participants to actually visualize prospective food consumption. If you ask them how much do you think you could eat right now, that they would actually visualize plates with foods, and that it's easier for them to understand and to answer that question, because those appetite-related sensations, as we call them, are actually behaving in a pattern that matches the pattern of the orexigenic gut hormones, and that's also what we observed in our study. So I think that that explanation might be found in some difference in interpretation between hunger and prospective food consumption scores. Yeah, so of course, first there need to be further steps undertaken before we go to treatment, but it would be nice, given the fact that in our study the bitter tastant decreases prospective food consumption scores and increases the reward system. And also, previous studies in our group, which are close to publication, found out that there is also a prolonged intermeal interval. So it might be useful that you just by giving capsules daily, twice a day, right before the meal, those are things that still needs to be elucidated, and really further research is warranted on that. But that it would just help obese patients in managing their weight loss. And it might also be something that they can control themselves, because it's just a bitter taste, and it's not actually a proper pharmaceutical product. So it might help them in, like, they're treating themselves. It's not like they're taking medications for their disease, which they often don't like being told that they're having any disorder. So I think in that way it might be, especially for the patient population that really wants to lose weight, but it's just like that little extra push that they need. But yeah, it's still too early days to jump to conclusions, so I really want to be careful about this potential treatment effect. Don't think that it's necessary for healthy individuals, but if there are like patients who really wants to keep their weight stable or something like that, it might be something that we could use, but I really think that obese and overweight patients are the way to go. But giving the complete gin and tonic hype, we might already be doing it maybe, but I think really the patient populations will be the patients or the people who would benefit from this study, or at least that's what we hope.